Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to go over some tips and recommendations to improve your standing tolerance and your standing duration after or before knee replacement surgery. Before I jump into that, be sure to hit that subscribe button if you don't already and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery, exercises, rehab and recovery, frequently asked questions, and much more. So let's go over some tips and ways that you can improve your tolerance, improve your ability to stand for prolonged periods of time after surgery and just tolerate it with minimal symptoms of pain, stiffness, discomfort. So first of all, you want to look at your standing position or your standing posture. We want to make sure we have equal weight on both legs. We don't want to be hanging or leaning on one side or one hip. We want to have equal weight and equal forces and stresses through both of your legs. So standing with a good base of support and equal weight bearing on both sides. You want to have good posture, just generally speaking. So you want to have your shoulders back and down, your chin tucked back and your head pulled up a little bit, your shoulders back, your hips and your back are in a good alignment, in good position. You're not slouching down, you're not overextending up too high, just a good general standing posture. And that's going to allow the rest of your muscles, your hip, your back muscles, and everything else to work in the most efficient manner. And then we want to think about, are we maintaining good blood flow and good fluid throughout the legs? So sometimes people stand very stiff. Maybe they stand with your leg super extended the whole time or in just one position. And this can actually reduce the blood flow to the muscles of your legs. So we don't want that to happen. So you want to be able to, slightly move, almost kind of fidget as you're standing. So shifting your weight side to side, forward and backward. Maybe you want to do some rocking. You want to bend your knees a little bit as you're standing. That's a good idea. You can also do some active movements. You can do some ankle pumps. Do some ankle pumps on one foot and switch and do the other foot. You can do some heel raises, going up and down on your toes. There's just things to keep the blood flow going as you're standing and up on your feet for a prolonged period of time. And then the best way to improve your standing tolerance is to simply stand. Spend time in standing and doing different things. I always tell people, find ways to perform functional type activities or activities that are going to distract you, and so you don't even realize that you're doing this. Obviously, if you just stand in place, that's not going to be enjoyable. You're going to get bored. You're going to get frustrated pretty quickly. So, for example, use intervals. So, period of time on your feet, period of time sitting and resting, and just doing that consistently, on, off. For example, you can do this when the commercials come on the television. You're just going to stand up and stand in place for the duration of the commercials and then sit back down while your show or whatever you're watching is on. You can also do just general activities. So, for example, when talking to someone on the phone, instead of sitting and reclining back in the chair, just stand up and talk to the person on the phone while you're standing. Or you can just find something to occupy your time. You can color, you can play cards, play solitaire, something to distract yourself. And then, of course, even better is find some sort of functional activity that you can do that you would normally do in a standing position. Maybe that's making a meal. Maybe that's making a drink or folding or putting away laundry. So doing that functional task, standing, trying to tolerate doing it and standing. So those are just some of my tips and some of the feedback to improve your tolerance and the duration that you can stand comfortably and do the different things that you want to do in standing after surgery. Thank you very much for watching. Again, be sure to hit that subscribe button, leave your comments and questions below. I'll be sure to get back to you. Thank you.